Right now, I want to welcome from Doctors for Responsible Gun Ownership, Dr. Robert Young is with us on the program. Dr. Young, how are you, sir?
Very good. Hello again, Cam.
It is good talking with you, and the news full of stories today about a new study based on data, they say, from 2012 to 2014. This is in the journal Pediatrics. They say on average about 1,300 children died annually from a gun-related injury in the United States. Obviously, Dr. Young, we're hearing a lot of folks say that this is proof that we need some sort of, oftentimes they don't get specific about what type of gun laws we need, but obviously this means we need more. But I was looking at this study, and I was looking at some of the...
Let's leave the governor of Virginia out of this.
Yeah, right. I know.
Right.
I know. What I was struck by when I was looking at this study and the states that had higher than prevalent rates of violence involving children or accidents involving children, you couldn't simply go down the list and say, aha, well, look, these states have a lot of gun control laws and they're safer, and these states don't have a lot of gun control laws and they're worse off. You had states like Maine, New Hampshire, Vermont that were very, very low in terms of accidents involving firearms in children, including intentional homicides involving children. And there were states like California that have a lot of gun control laws on the books where the numbers, quite frankly, were on the higher end of the spectrum.
That's always the case, though, isn't it? Anytime you look more closely at state-by-state laws versus experience, you find you find those states appearing to be outliers from what the anti-gun advocates would claim in both directions, which just goes to show that gun laws per se are not consistent at all with the experience of deaths and injuries due to firearm incidents.
Yeah, they say that the District of Columbia and Louisiana had the highest rates of child firearms deaths. Several states, including Delaware, Hawaii, Maine, and New Hampshire, had 20 or fewer deaths. And there was also, Dr. Young, it sounds like a little bit of a politicking involved here with the authors of this study talking about the need to talk to parents, also the need for gun control, right? One of the doctors said that introducing some sort of child access prevention law says that would have an impact on the home or, again, properly secure it. But even if the child or young adult does find the gun, they can't use it because they're not authorized to access the gun. Talking about the need for smart guns. This is also not particularly unusual, right? Taking a study and then using it to say, and this is why we need policy X, Y, or Z.
Well, right. Well, as usual, they take what little they can learn. That really, these are all things we knew anyway, what they put in their study, and try to extrapolate it to their political ends. The first maybe biggest problem with the study is they used the arbitrary age of 17 to consider the end of childhood, through which they've lumped all, quote, children, when the readily available statistics go in increments of 5 years, 1 to 4, 5 to 9, 10 to 14, and then 15 to 24. So once you get into the 15 to 24-year-old range, most of the incidents with guns are happening by dedicated gangbangers, usually amongst themselves. But it bears no resemblance to what's happening in the age groups that we would think of as children up to the age of 10 or 12 or so, in which, while firearms homicides, for one thing, are significant, the numbers are quite a lot smaller, and you can't make the case that it's as major an issue. I missed the part that you just read because I was so pleased to see an interview with CNN today with some of the authors too, who pointed out that yes, better storage, safer storage, locked storage, of course, that's an important thing to help keep our children safe, and we should all learn about that and all apply it whenever it's indicated, when we have children around or when we have children coming in and out, when we have adolescents around who are not well trained, who have personalities that we can't really quite trust with potentially lethal tools. But DRGO gets off the ship at the point that they start imagining that you can coerce private behavior. The comparison to seatbelts in cars is faulty because cops can drive along and see if somebody's wearing their seatbelt. That's enforceable. There's no way to enforce that in, quote, safe storage. There's no way to know who should, who shouldn't without invading people's homes, and we're not going to stand for it. So they just go too far back into their progressive mindset about making sure everybody lives according to their standards, which is unrealistic in the first place and impossible to accomplish in the second place.
Speaking with Dr. Robert Young with Doctors for Responsible Gun Ownership, and to that end, one of the other doctors associated with this study, Dr. Elliot Nelson, who's at the University of Vermont Medical Center, has an editorial that accompanies this study in Pediatrics. He says recommending to remove guns completely from a home can be off-putting. He said, rather, quote, we point out that parents may underestimate kids' propensity to handle guns unsafely even when they've been taught. He said excellent information can be shared on safe storage and locking methods that still allow quick access to a handgun if it ever were needed. And finally says, given the impulsivity, the risk-taking, and unpredictability of adolescents, we should promote safe storage as a routine measure. It seems to me one of the things that I've noticed, and I guess it's even evidenced a little bit in this data, showing that the District of Columbia, one of the worst locales in the country when it comes to accidents involving firearms and children. Dr. Young, I would not say that that the District of Columbia has a robust a culture of legitimate gun ownership. And in fact, I would argue that the local politicians in D.C. have done everything they can to squelch such a culture from developing. And it seems to me like this is part of the problem, right? I mean, if you want people to get that education and training, you've got to make sure it's available to them.
Teach guns. People who know nothing about guns have no business talking about how to manage them safely, of course. Yeah, and so, I was, and when I read that little bit too, though, maybe I'm too much some of my colleagues say I'm too much the optimist about the world and politics, but we do see them backing away from saying we should tell people to get rid of their guns. I think we scared them a little bit with all the legal and moral pressure that those of us on this side have brought to bear on that. So they're saying now we ought to at least let people know they should store their guns safely. We shouldn't necessarily tell them to get rid of them. Now, of course, they're not the experts on how to store guns, as we just agreed, but maybe we're making a little tiny bit of headway, if they're backpedaling. We'll see. We're not going to trust them yet, though. As the great Ronald Reagan said, trust but verify. And in this case, I think we'll just keep verifying.
Absolutely. Hey, Dr. Young, listen, thank you so much, sir, for coming on the program today. It is great talking with you, and I hope we get a chance to do this again soon.
I hope so, Cam. Take care.
You bet. Thank you. Dr. Robert Young with Doctors for Responsible Gun Ownership joining us here on Cam and Company.